Every single day, millions of people walk around with a sexually transmitted infection they do not even know they have. No pain, no bleeding, no obvious warning sign, just a silent virus living inside the body, waiting. And one of the most common ones, one that affects nearly 1 in 100 sexually active adults, is genital warts. Today, I'm going to tell you everything your doctor probably did not have time to explain. What causes genital warts, how to recognize them, how they are treated, and most importantly, how you can protect yourself and the people you love. So stay with me because this information could genuinely change your life. Welcome back. I am a practicing physician, and one of the topics I get the most questions about, both in my clinic and online, is genital warts. People are often too embarrassed to ask about it face to face, and I completely understand that. But embarrassment should never stand between you and your health. Genital warts are incredibly common, they are manageable, and understanding them is the first step to protecting yourself. So today we are going to break it all down in plain, honest language. No judgment, no shame, just facts you need to know. What are genital warts? Genital warts are soft growths that appear on or around the genitals, anus, and sometimes the inner thighs or groin area. They can be flesh-colored, pink, or slightly darker than the surrounding skin. Some look like small, smooth bumps. Others have a rough, cauliflower-like texture. They can appear as a single wart or in clusters, and they vary in size. Some are so small they are nearly invisible to the naked eye. What is important to understand right away is that genital warts are not just a cosmetic issue. They are a sign of a viral infection, and that virus can be passed on to other people even when the warts are not visible. The cause: human papillomavirus. Genital warts are caused by the human papillomavirus, commonly known as HPV. Now, HPV is actually a family of more than 200 related viruses. Most of them are completely harmless, but certain strains, particularly HPV type 6 and 11, are responsible for about 90% of all genital wart cases. HPV spreads through direct skin-to-skin contact, which is why it is classified as a sexually transmitted infection. You do not need to have penetrative sex to transmit it. Genital touching, oral sex, and anal sex can all lead to transmission. And here is what makes HPV particularly tricky. A person can carry and spread the virus without ever developing visible warts. That means someone can unknowingly pass it to a partner while appearing completely healthy. After exposure, the virus can remain dormant in the body for weeks, months, or even years before warts appear, if they ever appear at all. This long incubation period is one of the reasons genital warts are so widespread. Symptoms: what to look for. Now let us talk about symptoms, because this is where a lot of confusion happens. Many people infected with the strains of HPV that cause genital warts will never develop any visible warts at all. For those who do, the warts typically appear within 3 weeks to 3 months after exposure, though it can take much longer. The warts themselves are usually painless. However, some people do experience itching, burning, or mild discomfort in the affected area. In some cases, particularly when warts are located near the urethra, a person may notice slight bleeding or changes in urinary flow. In women, warts can develop inside the vagina, on the cervix, or around the anus, making them impossible to detect without a medical examination. If you notice any unusual growths in your genital area, do not try to diagnose yourself. Please see a healthcare professional. Genital warts can sometimes be confused with other conditions, including certain types of skin tags, molluscum contagiosum, and even some forms of cancer. A proper diagnosis from a doctor is absolutely essential. How doctors diagnose genital warts. 7-830. The diagnosis of genital warts is usually made through a physical examination. Your doctor will look at the affected area and, in most cases, can identify warts based on their appearance alone. For women, a pelvic exam and pap smear may also be recommended, since some strains of HPV, specifically types 16 and 18, which are different from the ones that cause warts, are associated with cervical cancer. In some cases, your doctor may apply a dilute acetic acid solution to the skin, which can cause HPV-infected tissue to turn white, making it easier to identify subtle warts that might otherwise be missed. A biopsy, where a small sample of tissue is taken and examined, is sometimes performed if the diagnosis is uncertain or if there are concerns about other conditions. There is currently no widely available blood test that can detect HPV in the general population. The virus is typically identified based on clinical findings. Treatment options: 830 11s. Here is some genuinely good news. Genital warts are treatable. They will not go away on their own in most cases, but with the right treatment, they can be removed and the discomfort managed. The goal of treatment is to remove visible warts. However, it is important to understand that removing warts does not eliminate the underlying HPV infection from the body. The virus can remain and warts may recur, which is why follow-up care is so important. There are several treatment options available, and your doctor will help you choose the best one based on the size, number, and location of the warts, as well as your overall health. Topical medications are often the first line of treatment. Imiquimod is a cream that works by stimulating your immune system to fight the virus. Podophyllin and podophylox are plant-based compounds that destroy wart tissue. Cynocatechins, derived from green tea extract, is another topical option that has shown effectiveness. These are applied directly to the warts and used over a period of weeks. For larger or more stubborn warts, in-office procedures may be necessary. Cryotherapy involves freezing the warts with liquid nitrogen, causing them to blister and eventually fall off. Electrocautery uses electrical current to burn off the warts. Laser therapy can be used for extensive or hard-to-reach warts. Surgical excision, where the warts are physically cut away, is another option, particularly for larger growths. None of these treatments guarantee that warts will not return because the virus may still be present in surrounding tissue. Some people need multiple rounds of treatment before the warts fully clear. Prevention, your best defense. Now, let us talk about what you can actually do to protect yourself, because prevention is always better than treatment. The single most effective preventive measure available today is the HPV vaccine. The vaccine currently recommended, known by the brand name Gardasil 9, protects against 9 strains of HPV, including types 6 and 11, which cause genital warts, and types 16 and 18, which are linked to several cancers including cervical, anal, throat, penile, vulvar, and vaginal cancers. The vaccine is most effective when given before a person becomes sexually active. It is routinely recommended for preteens around age 11 or 12, but it can be given up to age 26 for most people, and in some cases up to age 45 after discussion with a doctor. If you have not been vaccinated, please talk to your doctor about whether the vaccine is right for you. This is one of the most powerful tools we have in modern medicine to prevent certain cancers and a very common sexually transmitted infection. Beyond vaccination, using condoms consistently and correctly during sexual activity reduces the risk of HPV transmission, though it does not eliminate it entirely, because HPV can be present on skin not covered by a condom. Being in a mutually monogamous relationship with a partner who has tested negative for STIs also lowers risk. Regular sexual health checkups are important, especially if you have multiple partners or a new partner. Avoiding sexual contact when you or your partner has visible warts is also strongly advised, as this is when transmission risk is highest. Living with genital warts. If you have been diagnosed with genital warts, I want you to hear this clearly. You are not alone, and this does not define you. HPV is one of the most common viruses in the world. Many people who are sexually active will be exposed to it at some point in their lives. The stigma around sexually transmitted infections causes enormous harm, and it prevents people from getting the help they need. If you have genital warts, be honest with your sexual partners. I know that conversation is not easy, but your partners deserve the opportunity to protect their own health. If you are struggling emotionally with this diagnosis, please do not hesitate to speak with a counselor or mental health professional. The psychological impact of an STI diagnosis is real and it deserves attention just as much as the physical symptoms. If you found this video helpful, please give it a like. It genuinely helps more people find this information when they need it. Share this video with someone you care about because this is the kind of knowledge that can protect people and save lives. Subscribe to this channel if you want honest, doctor-explained health content delivered in a way that is easy to understand and completely judgment-free. If you have questions about anything I covered today, leave them in the comments below. I read them and I do my best to respond. And if you are experiencing symptoms or have concerns about your sexual health, please do not wait. Make an appointment with your doctor. Early detection and proper treatment make a real difference. Your health is worth it, and you deserve accurate information to make the best decisions for your life. I will see you in the next video.